Did you know that some people are losing up to 15% of their body weight on Ozempic? Sounds like a miracle fix, right? But here's the real question. Is it safe, sustainable, and worth it for you? Welcome to Flip the Script. I'm Dr. Lee, and today we are tackling one of the hottest and most controversial medications out there right now, Ozempic. We've all seen the headlines, seen the celebrities and influencers who are raving about it and showing off these dramatic before and after photos. But is Ozempic really the magic bullet for weight loss? Or is there more to the story? Today, we will be breaking down what Ozempic really is, how it works in your body, whether it's worth taking, especially if you don't have diabetes, how long it takes to see the results, how long you're expected to stay on it, and the risks and side effects that you need to know if you are considering this medication. So stick around because what I'm about to share with you could save you time, money, and a whole lot of frustration. Ozempic is a brand name for semaglutide, a medication originally approved by the FDA in 2017 to treat type 2 diabetes. It belongs to a class of medications called GLP-1 receptor agonists. GLP-1 is a natural hormone your body makes to regulate blood sugars after you eat. Ozempic works by mimicking this hormone and helping to slow digestion so food stays in your stomach longer, reducing appetite by signaling your brain that you're full, and lower blood sugars by helping your pancreas produce more insulin. The slowing of digestion is why people feel full quicker and eat less while on Ozempic, and this is actually how Ozempic leads to weight loss, even though it was originally designed for diabetes. But here's where it gets tricky. Ozempic isn't FDA approved for weight loss. That's what a sister drug called Wegovy is for. Yet many doctors prescribe Ozempic off-label to help people lose weight because it's cheaper and more accessible. So, if it's not approved for weight loss, but everyone's taking it for weight loss, is it even safe to take if you don't have diabetes? Good question. And here's where we need to be honest. Just because a drug helps with weight loss doesn't automatically mean it's risk-free. According to the Mayo Clinic, some common side effects of Ozempic include nausea, vomiting, diarrhea, constipation, stomach pain, and in rare cases, some more serious side effects like pancreatitis or inflammation of the pancreas. You can have gallbladder problems and possible thyroid tumors. It is important to note that the thyroid tumors that have been noted so far have been primarily in rat studies or rodent studies, and there haven't been any confirmed cases in humans yet. Let's talk about the cost. Without insurance, Ozempic can run you about $900 to $1,200 per month. And even with insurance, if you are taking it for weight loss and not diabetes, your insurance might not cover it. Imagine paying that every month, potentially for years. Clinical trials like the STEP studies showed that people lost an average of 10 to 15% of their body weight over 68 weeks. Yes, I said 68 weeks, which is about a year and 4 months. But here's the kicker. When participants stopped taking Ozempic, most regained their weight. The STEP studies were designed to look at weight loss over time in people who had a BMI greater than or equal to 30 without diabetes, or had a BMI of 27 or higher with one weight-related condition other than diabetes. The goal was to measure percent change in body weight over the 68-week period, along with other health markers like waist circumference, blood pressure, and quality of life. The trial aimed to see whether semaglutide, the 2.4 milligrams weekly, could help people with diabetes lose weight safely and effectively over time compared to placebo. This was the first major large-scale trial testing of semaglutide solely for weight management in a non-diabetic population. It is important to note, though, that the STEP 1 trial and other subsequent STEP studies were designed, funded, and overseen by Novo Nordisk, who manufactures Ozempic. The research was conducted in collaboration with academic researchers and independent investigators at various clinic sites, and while the investigators wrote the article, Novo Nordisk employees were involved in the data collection, analysis, and manuscript review. The primary author of the Step 1 publication also disclosed receiving consulting fees, speaking fees, and researching funding from Novo Nordisk and other pharmaceutical companies. Now, this doesn't necessarily invalidate the findings, but it is important to factor those in when considering whether evaluating potential conflicts of interest. So now the big question is If the weight comes back when you stop taking the medication, how long do you have to stay on it? Forever? And at what cost? Financially and physically. Here are some important things to know. Ozempic isn't meant to be a quick, short-term solution. It was designed as a long-term medication, and for many people, this means staying on it indefinitely. Why? Because once you stop taking it, your body's hunger signals and digestion speed up right back to where they were. And for a lot of people, that means the weight starts to creep right back on. So what does this mean for you? Well, you might start seeing the scale move by month 2 or 3, but the biggest changes, according to the STEP study, happen gradually over the course of a year. Remember, the study followed people over that 68-week time period. And when it comes to the long-term safety, here's where it can get tricky. The longest study we have on Ozempic, or more specifically semaglutide for weight loss, is about 68 weeks. That research shows that it's effective for losing weight during that time, but we don't have studies beyond that for weight loss in people without diabetes. There are ongoing trials that have looked at longer-term outcomes, but most of them are focused on other things like heart health, not necessarily weight loss. So while many doctors believe you need to stay on this long-term to maintain the weight loss, we really don't know what happens after several years of continuous use for weight loss and what the long-term risks might be. The longer you're on Ozempic, the higher your chance of dealing with those side effects I mentioned earlier. And the moment you stop, well, if you haven't addressed the underlying habits like nutrition, movement, and metabolic health, there's a good chance that the weight will return. That's something a lot of people don't realize. Ozempic manages the symptoms. It doesn't necessarily fix the root cause. So if you're relying only on the medication without building those supportive habits, you're basically handing the steering wheel over to that drug. I'd love to know what you think. Would you be willing to stay on a medication long-term just to keep the weight off? Or do you prefer focusing on natural, sustainable approaches? Drop your thoughts in the comments. I'd love to hear your perspective. If this video helped you rethink the hype around Ozempic, don't stop here. Check out the other videos that are popping up on your screen right now, and I've got more insights on how to help you take control of your health with confidence, clarity, and wisdom. And if you haven't already, be sure to hit that subscribe button so you never miss a chance to flip the script on conventional health advice. Thanks for watching.